laparoscopy, those has been addressed by robot, and thus we are able to deliver a better outcome to the patients. Now, what is robotic surgery meant? It is just a form of minimal invasive surgery, which is a computer-controlled system where whatever movement I am making, that movement are seamlessly transferred onto the patient's side without any delay or lag. So it is more like a Kathputli ka game where the person is manipulating the arms and the legs of the Kathputli. And it is basically possible because of the endorist movement. These instruments are morely function like our arms, and it is better than actually endorist because our hammer 270-degree movement, these have more than 540 of the movements. Gangaram is pioneer in acquiring all the robotic. In 2012, we acquired one of the first Da Vinci system in India, and till 2023, we have performed more than 1,400 cases. In 2023, we are the first in the Asia Pacific region to acquire Hugo by Medtronic, and till now we have performed more than 600 cases. And recently we also got Mizo, which is a made in India by Merrill, and we have did about 950 cases. And we have that concept of always being first in the technology side, which Gangaram has proved over this improvement. Now in urology, what it changes? Now first, nowadays, whenever a patient with a kidney tumor comes to me, my question to myself is, do I need to take out the whole kidney or can I preserve the kidney? So partial nephrectomy is possible, so why to sacrifice the kidney? Ureteric reconstruction of all type, pyeloplastic, implants, urogynecological fistulas, and practically no failures. We have the largest experience in India about radical cystectomy with intracorporeal conduit, and in a radical prostatectomy, when we used to do, if you're taking out the prostate, urinary leakage is something which is a consequence. Now it is a complication, it is not a consequence. So leakage is not there by using the robotic advantage. Comparison, you all know all these technical things that robot have a 3D vision, dexterity is very high, and ergonomics are excellent. A surgeon can sit. He is mentally not challenged by his ergonomics of standing for 3 or 4 or 5 or 6 hours. So these three musketeers in urology, the laparoscopy can be used only for diagnostic and ablative purposes. The 3D is used for complex nephrectomy. In few of the donor nephrectomies where we have multiple arteries, double IVC, difficult anatomy, we actually shifted to 3D because that gives me a 3D perception of all the anatomical structure. Adrenal, I am using 3D because adrenal is surrounded by, on the right side by liver, IVC, kidney, on the left side by spleen, pancreas, bowel. So you have to preserve all these things, and if you can see them better, you can preserve them better. Robotic is used for radical prostate, cystectomy, partial nephrectomies, and ureteric reconstructions. What it changes my life, before making this presentation, they are complementary. These are tools, and master is the surgeon. Now, this is the fourth musketeer, which we have just performed 3-4 days back. Can we control this musketeer from a distant away? Now, this is a picture in which I am